And I've got 4 points. The first is be proactive. Get started now. There are so many opportunities just waiting for you. The second is be bold. Don't be afraid to apply or lead on new ideas. The third is be ambitious. Think big and then go even bigger. Try to reach the sky. And the fourth is be compassionate. Take others with you. Support and mentor other children and young people to champion their interests. Thank you.
Accessibility is important to me because I have experienced the frustration of not being able to do something without planning it first. I know firsthand how it can impact a person and their family's daily life too. My older brother is deaf and has cerebral palsy, so it's something I've witnessed on a daily basis. Having to ask questions like, is there access via a loop system? Or can he access that with limited mobility? Or can we do it together or independently? But the answer isn't always yes. Accessibility has different meanings depending on who you ask. However, I believe that accessibility is inclusion for everyone, always with the adaptations and flexibility being available to all. Communication is another factor of accessibility, as well as because people have the right to ask questions and be heard, using the language that works for them, whether this is via a translator, communicator, symbols, subtitles. So accessibility has many factors. I think everywhere needs to have a 3-point plan that they use to check their accessibility in a project, in a clinic, or in other parts of life. This could include, number 1, check their communication needs. Do they need a voiceover, subtitles, large print, or pictures? Number 2, check their age and stage ability. Do they need an easy read version, someone to explain it? Number 3, check their access needs. How can they get to see you in person or online with as much independence and dignity as possible? Have a think about this 3-point plan and see what you can do in your team to make it more accessible to patients, families and staff.
So overall, when I think about our experience as a group, the most important thing for me that came out of it was that we were all given a space to kind of learn as we went along, and we were given a lot of space for creativity. We didn't exactly know how everything would work from the beginning, but we learnt a lot by staying open-minded throughout.
A top tip would be to keep an open mind throughout the project and adopt ways of working which work best for the group. There's no set rules on how to have an effective meeting, and there's lots of different ways to make sure members feel supported when it comes to mental health and well-being. So it's just important to do what works for everyone involved.
I've broken down what you can do into 3 steps. The first is to let young people know he is a safe adult they can trust and come and talk to if they have things going on at home. This could be implemented by going into school councils and youth clubs and asking young people for help creating youth-friendly resources that explain this. These posters could then be put up in waiting areas and in areas young people spend their time. The second step is get young people involved in supporting your services. You could do this by having a youth-specific patient participation group meeting where young people can advise on issues. Another way to get young people involved is to have a look at the You're Welcome guidance. You can then use this guidance to see how youth-friendly your service is and act on where you can improve. The third step is get skilled up. The first way you could do this is by signposting to up-to-date resources that cover a range of youth safeguarding topics like mental health, sexual health, young carers, LGBTQ+, care leavers and services for disabled young people. A second way to get more skills is to look at the different ways young people want to connect with their primary care network. This could include text messages and emails, and making sure young people are in a private space before having an online appointment. A third way to get skilled up is to attend training on communication skills. Examples of this include the Me First and We Can Talk training. Thank you for listening.
So I'm going to be talking about how can doctors support patients and families to be heard in health appointments. Well, I think the first thing that we're often told by young people themselves is that they really appreciate it when doctors and healthcare practitioners take a real interest in them as young people, as people first and foremost, which is what they are. And don't launch straight into how are you and how's your condition, but try to find out if they know that they play football or that they have a particular interest. They chat to them about that first. And that really helps before they go into the consultation. And just on that, we did some work with a group of care experienced children, and we asked them the question, what helps you most in your relationship with your healthcare professional? And one of the girls said something that I've never forgotten. She said, I like it, Ken, that's Scots for when they've got that look on their face that says, we do care what's going down with people. So very active listening.
Engaging children and young people in the NHS matters because it is the most impactful way of shaping the future by the children and young people who are the people that matter, because it's their future. So it's by them and it's for them.